Welcome back to my channel. Today, sadly, I have to report the news of the first death in Thailand related to COVID-19. Let's talk about what we know so far. The victim was a 35-year-old male. He worked as a salesman, and he's reported to have no underlying or chronic conditions, such as diabetes. However, he did have dengue fever. He was admitted to a private hospital for dengue fever in January, and his condition was not improving. At some point, around early February, he was transferred to the main Infectious Disease Institute in Bangkok, which is the main center currently handling COVID-19 and other infectious diseases. The reports thus far have been unclear as to the exact sequence of events, but it's believed he had contact with another COVID-19 patient, specifically a tourism worker who had contact with Chinese tourists. It's still not clear when this contact occurred, but it's being reported as though the contact occurred following infection with dengue fever. Therefore, it does not sound like this is a hospital infection. He tested positive for COVID-19 on February 5th, and I believe he was part of the announcement from the Ministry of Public Health on February 8th, which announced a total of 6 additional cases at that time. The patient subsequently tested negative for the disease on February 16th, and this was something I brought up in my last video. The health secretary said that 2 patients were in critical condition, but negative for the disease, and I was speculating how this could be possible. Well, now we know more information. As it turns out, this was one of those critical patients, and he had been infected with dengue. The other critical patient we know now is an elderly man with tuberculosis. The health secretary also stated that this man is currently negative for the disease. I'll be putting out a video later today about testing, and we'll see that these tests are not foolproof, and a negative result does not necessarily mean the person is disease-free, nor does it mean that the person is not capable of spreading the disease. So stay tuned for my next video to know more about that. Regarding his treatment, we know that he was given multiple antiviral medications, including favipiravir, which has been experimentally used to treat COVID-19 patients in China and elsewhere. It's also reported that he had received a transfusion from the taxi driver, who has already recovered from the virus, presumably to introduce the antibodies. We also know that he was on ECMO, or extracorporeal membrane oxygenation, which indicates that he was likely in ARDS, or acute respiratory distress syndrome. In other words, his lungs were no longer able to effectively oxygenate his blood, and a machine was doing it for him. Finally, we know that he passed away on Saturday, February 29th at 6:25 p.m. Doctors have said that his organs, including his lungs and heart, were just too severely damaged from the dengue and the SARS-CoV-2 viruses, and that ultimately his body succumbed. I think there are a couple important takeaways from this case. First, it highlights the importance of comorbidities. It's been widely shown that comorbidities, which has usually been referring to chronic conditions like diabetes or COPD, greatly increase the case fatality rate of COVID-19. Dengue fever can be an extremely harmful disease, particularly if the dengue virus reaches the point where it causes hemorrhaging and destruction of blood cells and organs. Additionally, dengue fever can cause capillary leakage, so basically blood fluids are leaking out of vessels in the body. So pretty much the combination of dengue and a lower respiratory viral infection is about as bad as a combination as you can come up with. So second, the positive and then negative results highlight the uncertainty in detecting the virus. Now, since he had received those treatments, it's possible that the virus that causes COVID-19 had truly not been present in his body. But it's also quite likely they just weren't able to detect it, or the results were not reliable enough. I'll talk more about that and how we actually detect the virus in the next video. And finally, this case with its treatments highlights the risk to critical care units if a widespread outbreak occurs. Again, we estimate about 20% of cases will be severe or critical. However, if the number of infections increases rapidly, 20% of a big number becomes a lot of cases that require hospitalizations and ICUs. Any health system has a limited number of ventilators and ECMO machines, and Thailand is no different. Thanks for watching, and stay tuned for my updates about the situation in Thailand.